Shown from Technique Peak, and today I'm going to show how to bias different nerves in an SLR nerve tension test. Okay, so when a patient comes in with radicular symptoms that go down the leg, you're going to raise their leg up straight, and whenever they feel that same familiar pain, you're going to want to lower it a little bit so they are not so they're more comfortable. And then in order to bias the sural nerve, you're going to put the foot in inversion and dorsiflex it. And then in order to do the tibial nerve, you're going to evert and dorsiflex. And then for the peroneal nerve, it's inversion and plantar flexion. And if they get more pain with one of the directions, then you can kind of rule that nerve is what's causing the radicular pain. So shown from Technique Peak.